Alrighty, good afternoon, everyone. Welcome to our webinar on the clinical reporting and reports role manager overview. Today we'll be covering the new clinical reporting suite, and my colleague Francesca Charles will be covering all of the materials, and she will give you a great idea of what these new dashboards can be used for. Um, so that you can leave today's session with some practical takeaways when looking at or reviewing or requesting access to these dashboards. Before I turn it over to Francesca to go through our materials today, I did want to just talk about some housekeeping items. So first, we have all the lines muted just to avoid distractions during the presentation. However, if you do have a question, feel free to use the Q&A feature, and we hopefully will have time at the end to answer your question. If not, we will definitely reach out to give you a great answer to your question. We ask that you try to keep the questions as broad as possible. And if you have something more account specific, happy to connect with you offline to answer your question. We are recording this session and we will share the recording and the slide deck to all attendees, as well as publish them to our website. Um, with that, I think that's everything I wanted to cover. So I'll turn it over now to my colleague Francesca, who can walk through the clinical reporting dashboard. Francesca?
Thank you, Kevin, and good afternoon, everyone. Thank you all so much for taking the time to join today's session. As Kevin stated, we are going to dive right into just a general overview of our new tool, clinical reporting. The product is a product that is internally curated by the CRISP team, and so we are really excited to bring to you dynamic dashboards that have been developed uh, in Power BI, if you're familiar with Power BI. The reports were developed in partnership with state agencies, hospitals, primary care, and public health stakeholders. Again, they are extremely dynamic and offer a wide range of um, analyses for your patient population, looking at demographics to readmissions, diabetes, and skilled nursing facility reporting, as well as referrals. So for today, we will take a look. I'll have an opportunity to demo the hospital revisit report, the diabetes prevention and control, which will be live later this summer, hopefully near the end of July, as well as the skilled nursing facility. So oftentimes we get asked the question, where are we getting the data from to source into the dashboards? All of the data within the clinical reporting suites are pulled directly from our ADTs, which we receive directly through our HL7 messages, through participant shared patient panels. We're pulling in the demographic, the CCD elements that are available to us, as well as lab and SDOH or HRSN assessments and referrals. Our panel demographics dashboard uh, provides an overview of patients from the selected panel. It displays the top chronic conditions based on the ICD-10 codes within the ADTs and CCDs, and allows for individuals to identify demographic trends and supports for care planning and care coordination. This particular dashboard has a series of filters for race, ethnicity, gender, age, language, as well as a very nifty map that allows for you to target specific areas within your county or within the state of Maryland for a more refined look at your patient population and their specific chronic conditions. And so if you're looking to identify high risk individuals, this is a great report to do so. In terms of the hospital revisit, which often is also considered as our readmissions report, this report provides very high level insights on the hospital revisit rates. And so we wanted to target initial hospital visits that have resulted into a revisit or a skilled nursing length of stay visit within a 30-day period. So it highlights potential patterns that have been related to either frequent utilization or some perhaps discharges that were not properly, I would say, shared with the beneficiary that has caused the beneficiary to return to the hospital. So in addition, it just supports additional care coordination and quality improvement initiatives for each of the facilities. Our perinatal, IMHS perinatal referral suite has two reports. One that is an aggregated data level, which displays very high level trends regarding county, age, gender, race, ethnicity, insurance, and referral status within the state of Maryland. The second report is a more patient level summary that offers the actual patient details within that report and allows for the facilities to track the completion rates for each of the referrals. So these two reports are designed to, again, provide visibility into patient engagement and referral completions. If you are familiar with the CRS report suite, you may be asking, what is the difference between the CRS reports and the clinical reporting tools? CRS reports are dynamic claims-based dashboards that are developed by a third-party vendor of ours that we partner with called H-Metrics. The clinical reports are not claims-based data. They are near real time, and we are utilizing the HIE clinical data that we receive through the ADT and CCDs. Those reports are also dynamic and allow for analytical reviews of the patient population based on the panels that we've received. Users are able to access clinical reporting now within the HIE portal, and the access is based on like all of our other applications and tools and services that we offer. They are secure and role-based. And so someone at your organization, the HIE admin or the reports role manager, POC, has to credential you with access to the specific reports as well as the applications. And henceforth, we decided to partner with H-Metrics and leverage the role manager or reports role manager application that is currently used to credential CRS reports for clinical reporting. Access is governed through the role manager tool. The POCs are able to credential the application as well as the report, and everything is managed directly through the HIE portal. So it is a two-step process to receive access. The application, clinical reporting application, will need to be assigned using the HIE admin tool, and the second step will require for the POC, the reports role manager POC, to credential the reports. And so within the HIE admin tool, the HIE admin will assign the services, and the service tile is clinical reporting. The reports role manager POC will then go into reports role manager, either create a new user account or assign the existing reports to an existing user. The steps when creating a new user account are pretty simple. It's entering the user's HIE portal email address, selecting search, selecting the primary organization, defaulting to the end user, and selecting save. That will create a new user account in Reports Role Manager. Once the new user account has been created, the POC will select the organization and assign in the dropdown the name of the organization. The reports will populate. We'll select view and add and save on the role profiles in the role configuration page. A POC does have the ability to remove specific reports. Let's say the organization has access to 5 or 6 reports, but an individual user only requires 2 of those reports. The POC has the ability to remove the reports by selecting the trash can icon and selecting yes in the pop-up to confirm removal of the additional reports. There are several workflows. We won't go through the workflows today for credentialing. We will share the slides with everyone on the call. And for additional context regarding workflows for credentialing, please feel free to reach out to the organization's HIE admin or POC. I will stop sharing so that we can dive into our live demo for today. All right. Kevin, can you confirm that you're able to view my screen? You're able to see my screen? Yes. Okay, perfect. For today, we are using our Sage environment to demo the clinical reporting tools. We are utilizing one of our partners, Connie, our affiliate in Connecticut, their dashboard, but your dashboard will look very similar, just with MD. So on your dashboard, you will have access to the clinical reporting tools application. If you do not have the clinical reporting tools application on your dashboard, please contact the HIE admin or reports role manager POC at your organization to request a credential for access to the application, the clinical reporting tools. Once you've selected clinical reporting tools, you will have a series of reports on your dashboard. Today, we are going to look at the revisit report. And all of the data in this report is using demo data. All right. We'll start at the very top. So the following sections are going to walk us through basically how to navigate through the chart while we provide some additional explanations on the key icons within the hospital revisit report. We'll start with the last refresh date. The last refresh date for the hospital revisit is based on a 2-year look back from the current date that you have logged into the dashboard. The initial hospital visits are from 33 days or earlier. They do exclude from the analysis and allow for the revisits to be captured within the time frame. So that helps us move toward a more accurate frame between the 30-day period. There is a panel selection dropdown. In the future, what we would like is to offer the capability for users to navigate between panels within each of the reporting suites. Meaning if your organization has more than one patient population and they are segmented in patient panels, you will have the ability to select between your panels. The Clear All Filters button clears any filter that has been applied within the dashboard here. It does not clear out any internal clicks that you might have done within the actual charts. So the Clear All filter clears only the filters that have been selected. The Notes and Documentation button will navigate you to a general data dictionary that has some quick notes on how to drill within each of the charts, and also provides some very high level definitions around the terms that are being applied within the actual reports. And again, any definitions around the logic that are being applied within the reports. And so as you can see, for the initial hospital visit, we have a patient's hospital visit classified either by inpatient, admissions, OBS, and their stay within that specific reporting period. Also provides details regarding the selection of drop downs within the filters that look at the 2 to 30 day period. Also, you're able to expand 72 hours, 4 to 7, 4 to 8 to 14 days, and so on. To navigate back to the report, we will select the Back to Report button, and that takes us directly into the dashboard. At the very top, we have within the body of the suite, we have total initial hospital visits, the hospital revisit rate. These are static cards that will update as we navigate through each of the charts or we apply a specific filter. So if we were to select a race, for example, you would see that the static cards dynamically responded and provided the total counts for that specific population. So we have the total initial hospital visits, the hospital revisit rate, the total hospital revisits, and the patient count. Our drop downs are the initial hospitals, the long-term care facility name, and so you're able to parse the data to look specifically at a long-term care for you to identify the total initial hospital visit, the revisit rate, and the patient count at the long-term care. The discharge dispositions, if you would prefer to filter for individuals that are at a hospice or were specifically discharged home, you're able to do so, and that will refine your total counts. The revisit patient class, again, if you would prefer to filter utilizing any of the selections for patient class, you can refine your search for inpatient or OBS, and that will update all of the tables. The final filters are race, ethnicity, age group, and the revisit within 2 to 30 days. So if you'd like to target a specific age group, you're able to do so as well and see if there are any specific trends within the hospital revisit based on your total patient count. And revisits within the 2 to 30 day span, you have 48 hours, 72 hours, and again, 15 to 30 days or no revisits. Within the chart, Just by hovering over and selecting a specific point, you're able to see that there is a pop-up that provides some additional details regarding the month, the year, and the revisit rate. In the total visits and revisits chart, what you're looking at here in blue are the total visits in comparison to the total number of revisits by month and year. And again, if you were to select a specific area within any of the charts, the rest of the charts within the dashboard, they automatically update. And to return back to your default, you'll need to select back into the dashboard that you've selected. The revisit rate by initial hospital. And so this particular chart offers an opportunity for you to see which of the initial hospital stays have resulted into a revisit and what are the rates that are associated with this particular um, this particular hospital. And for a facility that is interested in coordinating care with the hospitals, this is a great opportunity for you to target the patients and the date, the time, the period of time within the year that the individual had an encounter and follow up and conduct care coordination for the specific patient population. The revisit rate by long-term care chart displays the percentage of patients who returned to the hospital within 30 days of discharge from the specific long-term care facility. So like the revisit rate by initial hospital chart, you're able to view and analyze the various patterns and identify any trends within the long-term care facilities when users, you're able to quickly determine which facilities have a higher revisit rate. All right, the following charts. We have a pie chart that looks at the revisit patient class percentage. Here you're able to see highlighted in orange, gray, and blue the ED, the inpatient, as well as the OBS visits, offering you a unique perspective on the distributions of revisits across the patient classes. The chart, the patient count by number of revisits is a very interesting chart. Here you're able to see who your frequent utilizers are or high utilizers. Just by hovering over, you're able to see the total count of revisits and the patient count. So if we have a revisit, if we have a revisit count of 7, and we see that there are only 2 individuals who have had 7 revisits within the 30-day period, this is an opportunity to target the 2 beneficiaries and provide care and conduct care coordination for the 2 patients. The initial discharge disposition chart really provides a high-level overview of where the population is at the point of discharge. You're able to see each of the categories stacked and grouped by month and year, which reflects the final disposition recorded at discharge. And so by selecting a specific discharge category, you are able to filter the population. You're also able to just hover over and see the initial discharge month, the disposition, the patient count, and a total within the population. At the very bottom, we have a patient revisit table that offers patient details. And so you'll have the patient first name, last name, date of birth in the patient ID column, the initial patient class for the individual's encounter, the admit date, the initial hospital admit date, the discharge date, the discharge disposition, the initial hospital where the encounter occurred, the initial hospital discharge diagnosis, the description of the diagnosis, the length of stay at the initial hospital encounter, and the long-term care facility stay, the admit discharge name, the revisit, admit date, the revisit discharge date. If there was a revisit at a hospital, that is also captured with the name of the hospital, the reason for the revisit, the discharge description, and the patient class. The patient revisit table, all of our patient details tables, you're able to export by selecting the ellipses and selecting export data. Once you've selected export, you'll have an opportunity to select either the current layout, the summarized data version, and you'll select export, and that will download an Excel file that you're able to utilize to refine your search for beneficiaries and also identify specific trends. To close out of the report and return to the main dashboard, you'll select Close Report. And from here, we will go into our diabetes prevention and control report. This report will go live mid-July. We are really excited to have this report added to the suite of reports for Maryland. In this report, we have a unique look at the diabetes population. Technical difficulties. Let's see if maybe I can exit and return. Perfect. Again, we have a last refresh date, the panel selection, the clear all filters, and the notes and documentation page for the diabetes prevention report, where you're able to see the core measures, the global filters, as well as the charts and visualizations. And at the very bottom, we have a patient table that allows for further filtering. To return to the report, we'll select the Back to Reports. In this report, we're pulling in as static cards the patient count, the lab count, the patient with diabetes or percentage of patients with diabetes, the percent of patients with labs reported to Chris and shared. We're also offering an opportunity to select specific comorbidities related to diabetes, practice, PCP, the diabetes status, diabetic, not diabetic or pre-diabetic, a time period that looks at 3 to 24 months, race, ethnicity, gender, and diabetes type, as well as age range. For diabetes type, the dropdown should reflect type 1, type 2, or non-diabetic. In the charts, we are capturing the total counts for patients with diabetes, without, and the status. The diabetes type chart also captures the total patient count and offers a visual of the population through the graphs. The next chart is our diabetes status by demographics chart. This first initial view is looking at race. And so the diabetes status is color-coded, dark blue for diabetic, gray for not diabetic, and orange for pre-diabetic. And a user can easily hover over each of the sections to get more details regarding the race and the patient count, as well as status. In this particular dropdown, you are able to filter and navigate to ethnicity, as well as gender and practice. And so here you're able to view the individual practice and the status of the diabetes status for the beneficiary, as well as the total counts. The following charts look at lab result range by lab type. And for labs in this report, we are looking at A1C, eGFR, and UACR. Again, just by hovering over the graphs, you're able to see the different ranges where results for the labs fall and the total patient counts. The result ranges are also listed at the very top as a legend in this particular chart. The lab completion rates by lab type, we are always wanting to ensure that our patient population receive their labs or go out and have their labs completed timely. And this chart will definitely assist in comparing the beneficiaries with A1C and eGFR, as well as UACR completed labs and the percentage of the population within the specific time period. The diabetes-related comorbidities chart offers the opportunity for analysis of the comorbidities that are related to diabetes, and you're able to view the total patient count for each comorbidity that is reflected within the clinical data received through our CCDs, labs, and ADTs. And at the very bottom, we have a patient labs. Again, the charts at the very bottom are exportable. You are able to export to an Excel file. And here we're looking at the most recent labs for the beneficiaries. We have an observation date slider or date selector within the calendars, the lab table fields. You're able to remove or add any specific categories listed here within the table. The lab data that is available, so patients with labs or patients without labs, you're able to filter. The lab type range for A1Cs, if you select on the carets, you will be able to filter specific to the range that you've selected, and that will filter the table. for those individuals. And as you can see, we're looking at A1C 6.5 or above. That is another way for you to create a targeted list for beneficiaries and conduct care coordination. And of course, we have the time period between 3 to 24 months. That is our diabetes and prevention report. Really excited to have this report added to the suite of reports. The next report that we'll take a look at today is our skilled nursing facility length of stay report. This is the other report that will become available mid-July. Really excited for this. Similar to our previous dashboards, we have at the very top a last refresh date, panel selection, a clear all filters, and a notes and documentation section. Within this report, we really wanted to have a better understanding of the patient activities within the skilled nursing facility. So from an initial hospital visit to a skilled nursing facility, and if there were any overlapping stays while the beneficiary is at the skilled nursing facility. Another admission into a hospital, we wanted to be able to provide data on that. And so we start with our static cards that look at the patient count, the median SNF length of stay days, the initial hospital visit count, and the total SNF visits. In terms of filters, we have the initial hospital name available in the filter, the skilled nursing facility name, if there was an overlapping hospital, that will be captured in this filter, and you're able to filter by overlapping hospital, the age group, gender, race, ethnicity, any programs that have been shared within the patient panel or on the patient panel, we will be able to filter this data point in as well in the report. The total length of stay, the SNF discharge dates, the initial hospital length of stay, as well as chronic conditions. So the charts offer the median length of stay by month and year. And by hovering over each of the areas, you're able to see the total count. Here we're looking at the total number of SNF visits by month and year. And the median length of stay by SNF. So for SNF 4, we have a total length of stay of 25 days. The initial hospital visit by SNF visits, how many of the initial hospitals resulted in a SNF visit, of the initial hospital visits resulted in a SNF visit. And again, just by hovering over, you'll see the total count. The number of SNF visits by duration. So we have 116 visits that lasted 33 days, 187 that lasted 27 days, and so on. The chronic conditions chart will show or display the chronic conditions and the total patient count within the population. And our patient SNF hospital visit, which is capturing the patient ID first name, last name, date of birth, the initial hospital patient class, the initial hospital name, the initial hospital admit date and discharge date, as well as the discharge diagnosis and description, the SNF name, the SNF admit date and discharge date, the total length of stay, the discharge disposition, the overlapping name of the hospital, if there was an overlapping encounter, the overlapping admit date, and the overlapping discharge date. Again, by hovering and selecting the ellipses, you are able to export the table into an Excel and share with your colleagues. Okay, that completes our demo for today. I believe the only report we did not have an opportunity to review is the panel demographics report.
Feel free to reach out to us if you think of anything, or as you gain access to the reports and you have further questions or feature enhancements you would like to see. Feel free to contact us, and we are here to help you learn and continue the process of improvement for these reports. So I appreciate your time this afternoon, and hope you have a great rest of your day. Thanks.
Thanks, everyone.